Thank you so much, Dr. Lee, for your kind introduction. And good morning and good evening. My name is Kyung, and I'm a program officer at National Institute of Allergy and Infectious Diseases, or NIAID, under NIH in the United States. I'm here for Dennis Dixon, who cannot be here today due to another official duty. First of all, I'd like to thank the organizers for having me. This is very special for me since I'm a native Korean and I know a couple of people at Institute pastor in Korea. So today I will talk about NIH strategies for combating antimicrobial resistance, also known as AMR. NIH is the largest funder of biomedical research in the world. 27 different institutes and centers at NIH are represented by circles, each with a size corresponding to the budget of each institute, as shown in this slide. Among them, NIAID is the second largest institute after NCI at NIH, and is a lead institute for AMR research. NIAID has a dual mandate to pursue a robust research portfolio and to launch a rapid research response to newly emerging and re-emerging infectious diseases. Of them, AMR has been a major research and public health interest in NIAID. AMR poses a major global threat to human health prior to and during the COVID-19 pandemic. According to the Lancet paper, the AMR impact across the globe was deadlier than we thought. In 2019, the death toll due to AMR infections reached over 1 million. This is really equal to those from HIV and malaria combined. In addition, escape pathogens, including gram-negative bacteria, are among top 10 agents. Last year, CDC also published a special report indicating that there was a 15% increase in AMR infections and deaths among hospitalized patients in 2020 compared to 2019. This increase is apparent among known AMR pathogens, including escape. So NIAID has a special effort into investigating non-traditional approaches for the following reasons. Firstly, we have limited drugs to treat the AMR pathogens because they've developed resistance against the last resort antibiotics. Secondly, it's difficult to develop antibiotics for gram-negative bacteria due to their physiological characteristics. Also, vulnerable populations at ICUs and nursing homes are burdened by AMR infections, where conventional treatments are limited. Therefore, we've increased R&D for alternatives such as with phage, microbiome-based therapeutics, and vaccines. In 2019, NIAID published the AR research framework, which contains 7 strategic approaches as shown here, including leveraging data science and understanding antibiotic failures. Based on this, we've promoted various programs for traditional and non-traditional approaches by funding basic, translational, and clinical research. This is an overview of AMR initiative in NIAID for the last 4 years. From understanding the mechanisms of AMR, we've supported programs to develop new diagnostics and non-traditional therapeutics such as phages and so on. So I will highlight a few programs throughout the next slides. Basic research aims to understand AMR in bacteria as well as identify ways to combat it. This type of research is supported by investigator-initiated and targeted initiatives using R01 and R21 grants as well as contracts. One of the examples is the CARB Interdisciplinary Research Unit, also known as CABROS, which was established in 2021 to support the discovery of early research activities focusing on combating CDC-designated AR threats. Last year, 2 new centers were added to the program, expanding the scope of activities to include more studies on mechanisms of resistance and developing non-traditional treatments. Translational research aims to advance novel findings into products for AMR. 3 major programs support this type of research: various grants and product development contracts, research resources including genomic and bioinformatics services, as well as preclinical service. One of the research resources is NDARO, which is a central hub for researchers to access AMR data to facilitate real-time surveillance of pathogens. It houses over 1 million bacterial isolates and more than 27 million annotated AMR genes. We also provide computational tools such as AMR Binder Plus and StrandGE Explorer. So next example is preclinical services available to the scientific community to help them advance product development efforts. So this includes in vitro screening assays, animal models, as well as comprehensive tools to support applications of new drugs. And this is available free of charge to eligible scientists. We support several clinical trial networks to evaluate new products. 1, the phase 1 clinical trial unit to monitor the safety of therapeutic products. 2, the IDCRC to evaluate vaccine candidates. And 3, Antibiotic Resistance Leadership Group, also known as ARLG, which I am currently overseeing. Looking at a couple of examples of clinical research, the first one is an international study to evaluate the efficacy of Bexsero vaccine in preventing gonorrhea. If found to be efficacious, this will be groundbreaking of gonorrhea prevention, as there are no licensed vaccines against this pathogen. And this study began enrollment in December 2020 in the US and Thailand. The second example is ARLG, which is a standalone clinical network with a mission to develop, prioritize, and implement an AR research agenda. Since its inception in 2013, the team has reviewed more than 170 proposals and initiated over 60 studies. So far, 11 interventional trials were completed, and more will be done within the next few years. The team also obtained 2 FDA approvals for gonorrhea and chlamydia diagnostic testing kits. In particular, ARLG has been interested in promoting non-traditional therapeutics, such as phage therapy. They developed lab procedures and protocols for the phage susceptibility test. In addition, the team, along with NIAID, worked on a comprehensive review, which provides clinicians with a practice guideline for phage therapy. Based on these efforts, ARLG is currently conducting a trial of phages in cystic fibrosis patients with Pseudomonas aeruginosa. The study determines the PK/PD by counting and tracking the number of bacteria and phages in the subjects. Also, it evaluates the safety of the impact of the phages. And we believe that this is the first study to obtain such data. The plan is to enroll 72 subjects in total at 15 sites across the US. Beyond research activities to combat AMR, NIAID, led by Dennis Dixon, whom you may know, has been deeply involved in various national and international AMR-related policy work. I'm also working closely with Dennis in these activities. Some examples are Presidential Advisory Council on CARB-X, the National Action Plan for CARB, and the Transatlantic Task Force, also known as TAPFAR, resulting from a presidential directive. More notably, Dennis has been named as a U.S. governmental representative for the Global AMR R&D Hub. So, launched by G20 leaders, this hub aims to improve coordination and collaboration in global R&D. So with this, NIAID continues to be committed to supporting AMR research in coordination and collaboration internally and globally. Thank you.